Hello everybody. Here I'm going to present for you the Braden scale assessment tool. You know what is this tool? It is just a tool to assess the risk of developing pressure ulcer. It's very important to assess the skin of developing any pressure injuries or pressure ulcer. So this is the tool we are using because that actually hospital acquired pressure ulcer affecting more than 2.5 million patients in the worldwide. This results in significant patient harm, including pain, expensive treatment, and increase the length of stay and premature mortality. So to make the patient safe and happy, so here the nurse has to perform the assessment of the skin appropriately with this tool, which is the Braden scale. The Braden, it consists of 6 categories. First one is the sensory perception. 2 is moisture, 3 is activity, 4 is mobility, 5 is the nutrition, and 6 is the friction. So all these 6 categories we need to assess the patient for, so that we can know the patient the degree of having pressure ulcer. So we'll go to the first one, which is the sensory perception. The first one is the ability to respond meaningfully to pressure related to discomfort or pain. So we'll grade the patient number 1 if the patient is completely limited and maybe the patient he can't feel about the pain or discomfort and all over the body. We'll grade the patient number 2 if the patient is very limited, may will feel the pain most of the body he cannot feel it, so maybe half of the body he can feel it. So you'll grade the patient number 2. You can grade the patient 3 if the patient is slightly limited sensation of that pain or that discomfort, maybe 1 limb or 2 limbs he can have a problem, he cannot feel that limb, so you can grade him number 3. You can grade the patient number 4 if the patient is having no limitation and he can feel the pain all over the patient body, all over his body, and he can report for you the pain or that discomfort, so you can grade him number 4. Meaning that if the patient he cannot feel any pain or and discomfort and completely limited, so you grade him number 1. So if the patient having no impairment in that sensation, so you grade him number 4. Okay, half of the body he can feel the pain, so you grade him number 2. And if the patient is having slight, like he's having in one part impairment in the sensation, so you can grade him number 3, and no impairments you grade him into number 4. For the patient moisturization, for the moisturization, you know that it is the degree of moisture to which the skin is exposed. Actually we can grade the patient number 1 if the patient is very constant moist, that's meaning always you are changing the linen, so you grade him number 2. If the patient is very moist, so you can change the linen and oftenly, so this is you will grade number 2, because the patient you will change the linen maybe 2 times in a shift, while number 1 you will grade number 1 is for the patient who you will change it maybe 3 or 4 times in the shift. Like patient who's having diarrhea, so you may will grade him number 1 because you are changing every 2 hours. But for the very moist, which is graded number 2, no, it is at least maybe you will change it 2 times in a shift only. Okay, while you grade the patient number 3, which is occasionally moist, this moisturization let you to change the linen only for once in a shift. Okay, while you grade the patient number 4, the patient is already rarely moist, which is dry, so only you will change the linen or the diaper or the gauze. Here is due to only the routine, or because it is the routine, so that's the frequency is only for the routine, so you need to change that linen as a routinely. You have to rate the patient 4. Okay, you know that activity, this is the one that we have to assess the patient in the degree of physical activity that he is doing. So if the patient is in bed fast, what we have to do, that the patient is completely bedridden, so he's depending totally into the nurse. You'll grade him number 1. Here you'll grade the patient 2 if the patient is chair fast, so the patient from the bed into the chair, but it is only ambulation is very or severely limited, assisted while putting him in the chair or while putting him into the bed. Okay, so you grade him number 2. You grade the patient into 3 if the patient can walk occasionally to go to the bed or to the chair majority of the time, so you grade him to the 3. The patient walks frequently without any assistant to go to the inside or outside or at the bedside or going to the station, so you'll grade him number 4 because the patient is walking frequently. Okay. For the patient mobility, he can how the patient able to change and to control the patient his body positions. Meaning here the patient will grade him number 1 if the patient is completely immobile, he cannot move his position, he cannot move his extremities, make no changes in the body or extremity position, so you grade him number 1. The patient will be graded 2 if the patient is very often or very limited, occasionally slightly changing his position, so maybe only very limited to change his position, so you'll grade him number 2. The patient is slightly limited, but he's the one moving his body frequently, depending on him and his self, so he's independent to others, so you'll grade him number 3. If the patient is having no limitation, majority of the time he can move and change his position without any assistance, so you'll grade him number 4. So for the nutrition, which is the 5th part of Braden assessment, you'll grade the patient as number 1 if the patient is very poor, meaning the patient is in PO, he cannot get his food or clear liquid diet, or the patient in IV fluid more than 5 days. Take care, it's more than 5 days. The patient is vomiting, he cannot get, but you can get the patient as score 2, properly inadequate. The patient, he may receiving less than the body requirement, like liquid diet or NGT tube, but really less than the body requirement, so that's why you'll give the patient 2. If the patient, you will grade him number 3, which is adequate diet, like he's getting, depending on to the assistant, like nurse, she will give him NGT tube feeding and or TBN properly, is meeting the nutritional needs, but it's adequate because it's depending into the others like nurses or the caregiver. You can grade the patient for as excellent intake for the nutrition because the patient, he get his all full food without any assessment, does not require any supply for this one, so you'll grade him number 4. For the friction and shear, this is the 6 components, that is the force between the skin and what on the other surface, like air mattress, like the bed sheet or the linens or diaper or the gauze. So but here is mainly the draw sheet, like that, for example. So mostly we can go that we grade the patient number 1, that if there is a problem, actually moderate to maximum assistant in moving, so there is 2 nurse has to move the patient with the draw sheet, so that's meaning the patient will be will have graded as number 1 because there is a problem. If the patient having potential problem, you'll grade him number 2. That's meaning he's move freely but will have a problem later on, so require minimum assistance from the nurse or a draw sheet, so you'll grade him number 2. The patient having no appearance of a problem, move in the bed and the chair independently by himself, so that's meaning we grade the patient number 3. You can see that the friction and shear, it consists of 3 points graded from 1 to 3, not as other the categories, which is from 1 to 5. It's graded to be from 1 point to points number 4, but for the friction and shear, no, it is only 3 points to be graded. You know that the scoring pattern, if the patient getting from 19 to 23, that's the patient is not at risk. if the patient will get 15 to 18, that you need the preventive interventions and measure to prevent the patient to develop pressure ulcer. If the patient is 13 to 14, that means is moderate risk. If the patient got totally score from 10 to 12, is high risk to develop pressure ulcer really. If the patient is from 6 to 9, is very, very high risk to develop pressure ulcer. What here is that mean? There, if the score is dropping down, that's meaning that the patient is having very high risk to develop a pressure ulcer. While the score is increased, so that's meaning having no risk to develop pressure ulcer, meaning that the minimum score, if he's got it as a 6, so it is very high to develop, or maybe he's having the pressure ulcer, or the patient is having maximum score which is a 23, so having no risk of developing pressure ulcer. When to do this Braden assessment, actually you can know that on the admission time in initial assessment, within 8 hours we have to do it, reassess frequently based on the patient condition, and if there is any significant change in the patient condition also you have to do it. The signs that may indicate the patient will have pressure ulcer will develop it, so just take care for that signs. If there is a persistent erythema to the site, like flushing of the skin, hyperemia or discoloration of the skin that does not change when pressed, blister may the patient will have, or localized heat or localized edema, maybe localized abnormal hardening of the skin, or such localized or discoloration of the tissue, like localized cones if the tissue death has occurred already. So take care for these signs. Most vulnerable area of the pressure ulcer, as the nurses mostly we know that it is the heel, sacrum, so and ischial tuberositis, which is the buttocks, elbow and temporal region of the skull, shoulder, femoral trochanters, which is the hips, back of the head, toes, ears, and the spine. So take care for the vulnerable area when you are changing the patient position, so and you assess that area. Current health acuity, skin assessment, use of medical devices, previous patient having pressure ulcer, tissue oxygenation and perfections, like modification things, Braden scale score, that all these like co-modifications, this it may patient to put him into the risk of pressure ulcer. So what current things we have to do? So the nurse has to do the plan of care. Okay, what is the plan of care here? So to do the plan of care, the Braden assessment, like the score from 15 to 18, which is the preventive intervention at risk patient. Here you need the regular turning schedule, enable as much activity as possible. Protect heels, both of the heels you have to protect the patient, and use the pressure distribution surfaces. Manage the moisture and frictions and shear. Advance to a high level of risk if other measures risk factors are present. Braden scale, if that's between 13 to 14, preventive intervention for the moderate risk has to be achieved, like regular turning position or schedule, and we need enable as much activity as possible. Use the pressure distribution surfaces, manage moisture, frictions and shear, advance to a higher level of risk if other measures risk factors are present. Additional to all these things, we have to position the patient at 30-degree laterally inclines using foam wings. Okay. Also, if the patient is Braden from 10 to 12, the preventive intervention high score, this is the patient is high risk, so enable as much activity as possible, use pressure distribution surface, manage اللي هو moistures and frictions and shear. You know that advanced too high level of risk of other major risk factors are present. But you know what, in additional to this all things, you have to know that in addition to the regular turning schedule, make small shifts in their position frequently. The Braden scale, if it is equal 9 or less, so preventive intervention, high, very, very high risk patient for developing pressure ulcer. So enable as much activity as possible. Enable as much as activity possible. Use pressure distribution surfaces. Manage moisture, friction, and shear. Advance to a higher level of risk of other major risk factors are present. In addition to this all, you have to regular changing the patient position and add pressure distribution surfaces for patients with severe pain or with additional risk factors. So if the patient develop very high risk, so take care for these things. So this is regarding the Braden assessment, and then hope that it is clear for you this video, and have a good day and thank you.